Okay, today we are going to complete the pig heart dissection. So I'm going to be walking you through this dissection and you can be following along. So all of you are either already have a pig heart here or are about to get a pig heart on your dissecting tray. Some things that I want to talk to you about is safety. So each student is going to get a pair of gloves. So you should have gotten a pair of gloves. So I have 3 sizes to choose from. It may not fit perfectly, but just as long as you have gloves on your hands, don't take these gloves off until I say so, because once you get them off, you can't put them back on, and I don't have enough for students to actually have several sets of gloves. Another thing that you need to be aware of is the instruments. So there's an instrument kit for each dissection, and it includes a scalpel. This is what you will use the most. And this scalpel is actually really sharp. So every year I have a student that either just cuts their glove or possibly their finger. So you need to be really, really careful with this scalpel. Another thing that you may use is the dissecting scissors to cut out things. But these other things that are in here, you're probably not going to use. So you can put those off to the side. So really all you need is your scalpel and your dissecting scissors. For cleanup, that's another important thing. So you'll need to make sure you listen to directions. I'll ask you to throw away all the pig heart in the parts. Scraping, you'll kind of use it to sort of scrape down your dissecting tray. Be careful not to throw away any of the tools. You're going to clean up your lab area, which happens to be your individual desks, spraying them down, cleaning them up with paper towels. And at the end, take off your gloves. You do not do that first, okay? And then you're free to go and wash your hands. So I already went through the different supplies that you're going to use. The scalpel handle is sharp. You're wearing your gloves. This is the dissection tray that you have your heart on. And so the first thing we're going to do is we are going to look at the external anatomy of the heart. So the first thing we got to do is we got to make sure we're looking at the heart in the proper direction. So we want to make sure that we're looking at it from the anterior, which is the front, not the superior. So a couple things that you can look at. So these little structures here are called, well, you definitely want to make sure that you have your blood vessels up here. This is called the base. Down here is called the apex, where it comes into a point. Okay, and one thing you can look at to determine that you have the correct position is these little ear-shaped things called the auricles. They should be kind of folded inwards. Okay, that's how you know that you're looking at the heart in the proper position, which would be like face up, or the proper way to say that is this is anterior versus if you flip it over, this is posterior. Okay, one way that I know this is posterior is I can see very clearly right here, this is one of the major blood vessels, and that would not be on the front of my heart. Okay, so these auricles are your biggest thing. They're kind of like ear flaps that go like this. So you want to make sure that we're looking at the anterior side. So everyone's going to point to the auricles. Remember that this is our right and this is our left. It's opposite of how you see it, just like with a real heart, just like we've been talking about on paper. So the auricles wrap around the anterior of the heart like I showed you. Unfortunately, most of our hearts, excuse me, are not as clean as this one in the picture as far as being able to see the actual blood vessels. There's just a lot of extra tissue and stuff here, but I'll try my best to point those out and show those to you. So the first thing I want you to notice as well is called the coronary vessels. We've talked about these before. This is what supplies the cardiac muscle itself with the oxygen it needs and to take away the waste products that it does not need. So on this view, you should see these coronary vessels pretty easily on the anterior of the heart. You have some down here. They kind of branch off. They're right there, right under that outer tissue. So now we're going to point out the large veins and arteries that transport blood to and from the heart muscle. So the first one I want us to try to locate is the aorta. So you have to realize in this position, okay, the aorta is going to originate from the left ventricle, and there's going to be an arch that arches towards the left side of the heart. So a lot of people want to think that this very top one right here is the aorta. I'm going to put my finger in it. This is actually not the aorta. The aorta, if you can see here, is actually this blood vessel, okay? And if I put my probe in it, I can try to put my probe in the aorta here. Some hearts are better than others to see. Maybe it's just better with my finger. If I stick my finger here in the aorta, okay, I'm pushing up against it right here. So this is the aorta. And if it was not cut off, it would have been the arch. So it's actually, a little bit under what you would call the pulmonary arteries and the pulmonary veins. So that's the aorta. And if I were to stick my finger, you could even try that now. You'd stick your finger in and it would go into the right side of the heart, what it would feel like. And it's hard to feel, but it doesn't actually go into that right side. It's stopped by a valve, okay, and which is the aortic valve, which we may get to see here in just a moment. So I want everyone to try to find the aorta. Your heart may have some of these parts of the aorta that branch off. You might be able to see some, like this one right here is part of that. These small ones up here, but those are not super important for us to point out. We didn't talk about them too much. All right, now if we look at the posterior view of the aorta, if we actually turn it over, okay, the aorta is actually going to go this way. And so, we already pointed that out. So the aorta is down here, and it would actually go that way. But we're going to stay on the posterior side here because I want us to point out the vena cava. So we should be able to see the inferior and superior vena cava. Now, because we're in the posterior view, this is actually the left side of the heart, and this is the right side because we have flipped it over. Okay, so if you find this right down here, okay, this is the inferior vena cava. You could probably put your finger in it, and if you follow, it is going to go into that right ventricle, okay, which is the right atrium, which is up here. And then if you keep your finger in there, you should be able to also feel the superior vena cava. And if you could see here, my two fingers are actually meeting, okay, because they all dump into that right atrium. So this is a really great example of the superior vena cava and the inferior vena cava coming together. So I don't know if you can see my fingers in there. So they're actually meeting and they're dumping into that right atrium. So I want you to try to locate those. This is harder to see, but the pulmonary artery, so if this is my vena cava, the pulmonary arteries are going to be a little bit above that. I can kind of see an opening up here. So remember, those are the arteries that are going away from the heart to the lungs. They've been cut down quite a bit, but you can see there's several little other big blood vessels that you're going to find up there. We're still in the posterior view. You also probably are going to see little openings for the pulmonary veins. You have a right pulmonary vein and a left, so each of those is coming from either side of the heart, either side of the lungs. All right, now it's time to actually look at the internal anatomy. So the best way to dissect the heart is on a coronal plane, which we're basically going to put it on its side. So you turn the heart on its side, we're going to go back to the anterior view right here, and we're going to put the heart on its right side. So the left side is up, and I'm going to hold with one hand, okay, the top of the heart with these great vessels. And then the other hand, I'm going to be cutting. So you basically want to start, okay, up here where the auricles are. And you want to make sure, I'm going to try to get a good cut here for you. You want to make sure that, just start doing little slices. And it will get easier as you kind of start to go deeper. And you want to make sure that you are cutting, if you kind of cut too shallow or too deep, you're not going to get a good look at the inside of the heart, but I'm kind of starting to slice. And because I've done this so much, y'all, I can kind of feel a little bit better and I can kind of look and see I'm getting a pretty good cut here. I'm going to have to open it up a little bit more. So you're just going to be cutting and be very careful not to, even if you can do this without cutting valves, that would be wonderful. You see, I'm starting to open this up. You're starting to get a good look here of those valves, and I'm not going to cut those tendons so that we can see them. So I've cut this one side, and then I'm going to flip it And I'm going to try to go along that same plane here, and I'm going to continue to cut on the other side of the heart. So let me continue through that. Okay. So if I open this up, I have to cut through the tissue a little bit better. I went a little shallow on this side. Okay. So if I were to open this up on my anterior view, I'm going to kind of open it up like this. And then I'm going to try to cut some more of this muscle so that I can get a really good look at this. And I'm going to be able to point out all of the interior of the heart. So I'm kind of cutting there so I can open it. I'm going to cut here so I can open it. See some of that aortic valve there. Okay. Very good, very good. Good job, Miss Barnett. Okay. All right. So that picture kind of shows, I don't want to cut into these tendons just yet because this is such a great view. So, you know, we talked about the valves of the heart. So when I'm opening these up right now, okay, so what you're seeing here, you're going to see, let me actually see if I might cut the valves a little bit here just so I can see in a minute. They're connected really, really tightly, those chordae tendineae here. So that's going to be your tricuspid valve. This is your mitral valve. You can really see the points of that connected to those papillary muscles. I'm seeing a good pulmonary valve right here. The aortic valve is probably a little bit deeper into the internal part of the heart. So now I'm actually going to, once I kind of look at those valves a little bit, I'm actually going to break them up here so that I can cut this a little bit more. So I'm going to break those valves open, try to break some of this muscle open. And I'm just kind of using, you know, I'll kind of see, I'm kind of like just going like this, just real smoothly. So you don't want to break anything that you don't intend to break. Nice. Okay. So I'm going to cut some more of this. There we go. So I have this, you know, so this is my anterior and this is my back. So what I'm looking at here, okay, is I'm looking at my left atrium, my left ventricle, my right atrium, and my right ventricle down here. Okay, so now that we have it open, we can go through. So you're going to cut. It's not going to look as nice as this one, but you have the anterior half up here, the posterior half down here. Okay, so let's locate our atrium. So I want everyone to find the right atrium and the left atrium. Okay, so here is my left atrium spot. Here is my right atrium. It's quite large to receive all that blood from the body. So look at the right atrium. Look at this wall here versus the right ventricle versus the left. Remember we talked about how the left ventricle has such a thick wall. And if you recall, it's because the left side of the heart exerts a greater force. So the muscle has built up, and you can clearly see that difference between the left ventricular wall and the right ventricular wall. All right, here we have the valves, okay, that I wanted you to see. So here's those chordae tendineae. Those are really, really strong. You can try to pull on them, just feel how strong they are. They are connected to these papillary muscles in the ventricles. And then the cusp of the valve is kind of up here. You can it kind of looks like the parachute. You know, just really get in there and just pull on those. Just feel the strength of those valves. They're absolutely amazing. And I'm opening this one up. So here's my tricuspid valve. And I kind of cut into that a little bit differently, but I can see just how deep that right ventricle goes. And those valves are honestly just amazing. The mitral valve, okay, is over here. That's what I showed you. Notice the septum. This is what separates the right and the left sides of the heart. There's a nice wall of tissue right there as well. And then you can see the cusp of those valves. So there's three parts to those valves. You've got the chordae tendineae, and you've got the papillary muscles, and then you have the cusp of the valve. Okay. And so those are the main interior parts of the heart. Now, we could possibly find another one of the valves. Now, it looks different than the other ones, and I'm not sure if I cut into it, but it is hard to find. This is what's left over right here. I don't know if you can see in my camera, if I can try to get close here. Okay. So this is kind of what's left over of my pulmonic or my pulmonary valve. I kind of cut into it, but that was part of it right here. And I'm not seeing a great aortic valve here. Some of you might, if you do a really great dissection, you might actually get to see the aortic valve, but that's a little bit more deep than where I cut. So we were able to look at all of these interior and exterior parts of the heart. And I want you just to imagine, this pathway, if we go back and close this, okay, this pathway that we've been learning, okay, of how blood flows through the heart. It's going to be the same, for even a pig, because it's a mammal. So it's coming from the vena cavas. It's going into the right atrium, to the right ventricle, out the pulmonary arteries to the lungs, circle back through the veins, goes into the left atrium, to the left ventricle, and out the aorta to the rest of the body. So you could just imagine all of this blood being able to go through the heart. Now I'm going to give you the instructions for clean up. So the biggest thing is that you do not want to take your gloves off. Okay, so we want to make sure we leave our gloves on to the very end. Okay, so all the parts that we kind of cut through, whatever Miss Barnett lets you do have to throw them away. No, you cannot take them home, even if they are in a plastic baggie. Okay, so you're going to throw all the parts away into the nearest trash can. We have a few trash cans around. And even if you have like heart parts in the dissecting tray, just try to scrape them out. Then you're going to go and rinse your tray and your scalpel in the sink. And then we're going to use the paper towels to dry up any of the extra liquid at your dissecting desk. And then once you feel like you have cleaned up, you ask for me to come check your station, your location, and I will give you the okay that you're good. And at that point, you can take your gloves off and wash your hands, but not before you do that. I hope that you enjoyed this dissection. Now we are going to do our post-lab work. Thank you so much.